Okay, let's talk about Figo system 1 and Figo system 2, abnormal uterine bleeding 2018. There is frequency in the parameter, frequency, regularity, durations, volume and intermenstrual bleeding. Okay, in the frequency, amenorrhea is now the part of the frequency category. Regularity, refined definition of regularity, normal variation, that is shortest to longest variation is 7 to 9 days. Slight variation is depend on the age. The durations, now only two categories for duration: if it is less than equal to 8 days, or prolonged duration if it is more than 8 days. Volume, definition of the symptoms of HMB, nice definitions. Bleeding volume sufficient to interfere with the woman's quality of life. What is intermenstrual bleeding? Definition of the symptom of intermenstrual bleeding: spontaneous bleeding occurring between the menstrual period, can be either cyclical or random bleeding. Okay, cyclical intermenstrual bleeding or random intermenstrual bleeding. The summary: changes to Figo AUB system 2, causes contributor to AUB in the reproductive year is palm coin classifications. Category 2, system 2, changes AUB adenomyosis, refined sonographic diagnostic criteria, the MUSA criteria they have included. AUB leiomyoma, inclusion of type 3 as a sub previously. The type 3 is category is other. Now they have type 3 is included as submucosal leiomyoma. The type definition and distinction between type 0 and 1 and 6 and 7, distinction between type 2 and 3 and 4 and 5. No longer AUBC, no longer AUB associated with pharmacological agent that impair blood coagulation, which are now included in AUB iatrogenic. Like heparin, drug induced, all are like iatrogenic, no longer included in the coagulation. AUBC. AUB now include AUB as all iatrogenic process, including the use of pharmacological AUB iatrogenic, including all iatrogenic process, including the use of pharmacological agent like any heparin, low molecular aspirin, use of any anticoagulation, those the third to enter with the ovulations. AUBO diagnostic threshold changes based upon the revision system 1, no longer include ovulator disorder associated with the drug known suspected to enter with ovulations. AUBN, the name of the category has been changed to not yet classified, or not changed from not yet classified, not otherwise classified, changed to not yet to not otherwise. There is a brief discussion of potential new cause of AUB is so-called uterine or isthmusally following lower segment cesarean sections. Okay. In the parameter, first is frequency. Absent, if there is no bleeding, no absence of menses is called as amenorrhea. The infrequent cycle, if it is a more than 38 day cycle. Infrequent, if it is a normal, is 24 more than equal to 24 days or less than equal to 38 days. Frequent cycle is called as when cycle every less than 24 days. The durations, normal duration is less than equal to 8 days. If prolonged durations is more than 8 days. Regularity, normal or regular, shortest to longest cycle variation less than 7 to 9 days. Irregular, shortest to longest cycle variation more than 8 to 10 days. 7 to 9 days is regular, 8 to 10 days is irregular. Flow volume, patient treated light flow, normal flow and heavy flow. Then intermenstrual bleeding. Intermenstrual bleeding between cyclically regular onset of menses or random. It can be it can be random, it can be cyclically predictable. Early cycle intermenstrual bleeding, whether it is mid cycle intermenstrual bleeding, whether it is late cycle intermenstrual bleeding. The last one is your IMB, then unscheduled bleeding on progesterone or estrogen, gonadal steroid, birth control pills, patches, ring and injections. Remember this, very very important. 2.1 intermenstrual bleeding and unscheduled bleeding. Intermenstrual, it can be cyclical, it can be random, cyclical early, mid, late cycle. Unscheduled bleeding on progesterone or estrogen, gonadal steroid, birth control bleeding, patches and injection. Not applicable, not on gonadal steroid medication, non-gonadal steroid medications present. Okay, then Figo AUB system nomenclature definition for 2000 intermenstrual bleeding has been added. Now the practical definition of irregular menstrual bleeding created by using 75th percentiles, effectively excluding the occasional long or short experienced by many women. The available evidence suggests that the use of the criteria normal range shortest to longest cycle variation is if it is 18 to 25 years. Remember, very very important, I will tell repeatedly 18 to 25 years age, if it is less than equal to 9 days variations, okay, that is normal. More than 9, then it is irregular. 26 to 41 days, if it is less than equal to 7 days variation, it is normal. If it is more than 7 days, it is irregular cycles. For 40 to 45 days is less than equal to 9 days, it's irregular. It is normal. If it is more than equal to 9 days, then it is irregular cycles, cycle variations. Okay, regular and irregular, durations, flow, frequency, ups and infrequent, frequent. Okay, so remember 3 age categories, 3 age group. First is 18 to 25 years, then 26 to 41 years, then 42 to 45 years. If it is 18 to 25, the duration is less than 9 days. 26 to 48 days, 41 days, 7 days. Remember, very 9, 7, 9. Remember, very easy, very easy. Only things, the categories of 3 categories, 3 age group categorizations. First is 18 to 25 years, 26 to 41 years, 42 to 45 years. If it is 18 to 25 years is less than equal to 9 days, 26 to 41 years less than equal to 7 days. If it is 22 to 45 less than equal to 9 days. Excessive menstrual blood loss, which have a HMB as per nice excessive bleeding loss, which enter the woman's physical, social, emotional and or maternal quality of life. Physical, social, emotional, PSEM. Physical, social, emotional, maternal quality of life. Frequency has updated in frequency less than 14 days, frequency is less than 50 days, irregular modified to 18 to 10 days.